Hello everybody and welcome to the Thursday edition of Video Clips. Well, there's a lot wrong with healthcare these days. That's what I spend Tuesday and Thursday video clips talking about, is what's wrong with healthcare. But we seem to spend an awful lot of time figuring out who's going to pay for it instead of looking at what we're doing and is it worth paying for, and how we should organize the healthcare system so that it's more efficient and that sort of thing. Well, a lot of people think that American healthcare would improve if it was converted to a single-payer system administered by the government. Senator Bernie Sanders proposed that during his presidential campaign, and he gained a lot of traction. And he's not the only person in Congress who thinks that this is a good idea. There has been for decades a movement to try to do universal health care administered by the government. By the way, polling shows that both doctors and patients love this unless you insert questions about the cost, at which point in time nobody loves this, because people really are not prepared to spend more money, and we've already seen what happened with the Affordable Care Act. People still have sticker shock about how much money they're spending. Well, like many things, single-payer systems sound like a good idea, but a closer examination of countries who use such a system identifies a lot of flaws and challenges that most people, including advocates of the systems, do not seem to be aware of. So there are a lot of countries. I chose Canada because it's often cited as an example of the best system, and many Canadians say that it is. But let's face it, if you're promoting a single-payer system, you're going to find all the Canadians who love it and put them on YouTube. You're not going to find the Canadians who hate it. So I'm going to show you the other side of this. I'm going to tell you how the system works and how all that sort of thing. Then you can decide for yourself what you think. In Canada, insurance is publicly funded and it covers everyone. Everybody gets the same coverage, and everything that is covered is paid for. There are no co-pays. Canadian provinces spend about 38% of their annual budgets on healthcare, and the system is financed in a number of different ways, including federal and provincial funds together. It is true that Canadians spend less on healthcare than the United States does, a little more than 10% versus 18% in the United States. So it's a less expensive system, but in a minute you're going to understand why that is. The problem is that the Canadian healthcare system is not much better than ours. That's the first thing. It ranks only 2 spots above the United States in the areas of timeliness, outcomes, and equitable access to care. In other words, it's not at the top of the list of countries that have great healthcare systems. So if you're looking for improvements in American healthcare, you're not going to look at the Canadian system. You're going to go to the top of the list. And in a future video clip, I'll try to cover those. Additionally, government insurance only covers doctors and hospitals, things like prescription drugs, eye doctors, physical therapy, psychotherapy, and specialists not covered. So you have to purchase an additional insurance policy to cover those things, or everything is out of pocket. Healthcare contributes to a higher tax rate in Canada. Canadians not only pay more for income tax, but there are other taxes, such as a tax on almost all goods and services sold in the country. To make ends meet, some provinces have an additional health insurance premium which is added to your local tax bill. The system is definitely expensive, so think about this. You've got federal income tax, you've got provincial tax, some provinces charge an additional tax for health insurance on top of it. Then you have to buy a private insurance policy to cover all the things that the public insurance doesn't cover. So you would think that that expense would buy better health care, but as I mentioned before, Canada does not rank at the top of the list of countries. In fact, Canadians often wait a long time for health care, sometimes so long that the outcomes are worse as a result. The average wait time for cataract removal is between 37 and 148 days, depending on the province. One citizen of Canada told Medscape that poor people often wait even longer. He said, quote, "We do have a two-tiered system. Most know it. Few will admit it." The Canadian government prohibits private insurers from competing with the government plan, which means that the only viable option for those who are dissatisfied with the system or are waitlisted for care is to seek care outside the country. Well, many Canadians do, and the medical tourism business to the United States is quite robust right now. Many doctors don't like the system any better than the patients appear to, and they don't like this monopoly situation, and some of them have started filing lawsuits in an attempt to gain the right to start competing systems. There are several problems associated with trying to install such a system like the Canadians have here in the United States. And one of them includes that Americans just have higher expectations. Wait times and a one-size-fits-all, no alternatives available system would not go over well here. Americans are used to having choices, and the Canadian system simply does not permit choice. As mentioned previously, doctors don't like the system either. Now, when you think about it, everybody's complaining about our current system. Doctors don't like it, patients don't like it. So I can't fathom why we would spend a lot of time and money and aggravation bringing in or importing a system that seems to make just as many people unhappy. I mean, there are people you can put on YouTube who think the American system is great. So everybody can come up with a poster child to, or several of them, to talk about how great things are. The fact of the matter is most people in America are at least a little bit disturbed about healthcare. So this brings me to the other factor, which is cost. I mean, think about it. The Affordable Care Act was passed quite some time ago, and people are still complaining, and the costs are still going up as a result. So tripling, doubling, or tripling the health care bill, which is invariably what this would do. Think about it. The Canadians keep taxing, adding more things just to cover doctors and hospitals, and people have to pay for everything else with a private insurance policy. So I don't really think that Americans are ready to take on hugely bigger healthcare expenses. And in addition to this, you've got a significant number of families that would be negatively impacted in terms of their quality of life. Because if you have to pay more for healthcare, you're going to have less money to spend on something else. Well, I think legislation that affects Americans in such a profound way, like healthcare and health insurance, should be considered in a very open and transparent way. And I think that if there was more widespread knowledge about the Canadian system and other systems like it, I think even some of the advocates would cool down their enthusiasm quite a bit, and we wouldn't have so much constant agitation to try and adopt a similar system here. But unfortunately, that's not the way it's done. Evidence is ignored or misrepresented in order for politicians to move their agendas forward, and sometimes the agenda really is about giving people free stuff, which always sounds good until someone figures out that there is no free stuff and you have to pay for it, and that's what happened with the Affordable Care Act. All those things that had to be included in policies at no extra charge, well, there was no such thing as no extra charge, which is why my insurance premiums are 400 and some percent of what they were before that law was ever passed. And by the way, in case anybody thinks that that was just how much the insurance costs would have gone up anyway, I'd had the policy I'd had for a long time, and there was never these big jumps in the price of premiums. So somebody has to pay for this stuff, and everybody's always happy for somebody else to pay for it. But remember, when the government pays for things, that's you and I paying for things, all right? The government doesn't have any of its own money. It's only what it can confiscate from people like you and I. Another problem in terms of the way that legislation is done in this country is many members of Congress are career politicians, which means that they can happily pass all kinds of laws in Washington that they will never have to suffer the consequences of as normal citizens. Historically, American politicians weren't like that. They used to be reluctant servants who couldn't wait to return to their normal lives. I mean, you can go back and read some of the things that Abraham Lincoln wrote. He could not wait to finish being president so he could go back to Illinois and just practice law. And people tried to talk George Washington into running for a third term. He didn't want anything to do with it. He couldn't wait to get back to his farm. Same thing with Thomas Jefferson. Today, our elected officials run for Congress 20 times. They keep running for things. And I see this in Ohio. They trade seats so that they can run for something else when they get termed out of one thing. I mean, it's ridiculous. Many have been engaged in politics for so long. They haven't been involved in business ownership or regular employment for decades, and some of them not at all. I mean, I almost want to make it a requirement that if you're going to run for Congress, you have to prove that you've been employed gainfully, for 10 years before you can run, and maybe own a business, because they sure do have a lot to say about what business owners like us should be doing. Well, this is only going to change if members of the public take it upon themselves to be informed. In other words, what I'm telling you is that I probably told you some things about the Canadian system that you didn't know. I would bet money that most of the people in Congress who are saying we need a single-payer system, they don't know this stuff either. So you better know. It's the same thing I talk about every Tuesday and Thursday, which is the importance of consumers to be informed. So just like you can't trust your doctors and healthcare professionals, do not trust members of Congress to tell you what is good for you. You need to take responsibility for it. And I think if all of this was discussed out in the open, and had it been during the days when the Affordable Care Act was being considered, it never would have passed, and people who voted for it could never have been reelected. We need to get to that point here, where people who vote for bad laws cannot be reelected. So why are these people still there who voted for it? I think part of the reason is people underestimate their ability to change things and resign themselves to do what the nanny state government bureaucrats tell them to do. So here's my stance on this issue. In case you're confused, you probably know I don't like a single payer system. I've never seen one that could effectively work in the United States, because the United States is different than other places, and doubling or tripling our tax bills is not an option. I mean, people would revolt in the street, I'm pretty sure of it. I am for making sure that health care is available to everyone, and I think the way to do that is to go back to what I said when I started this, which is to take a really good look at what we're doing in healthcare, eliminate the excesses and the things that can't help people, and take all the money that we save, and we'd have lots of it, believe me, if we stopped doing things that didn't work in healthcare, and that would give us enough money to offer care to everybody in the country, including the people who couldn't afford it. So I think that's the way to do this. And then I'm for term limits. Get these people out. I mean, some of them are so entrenched that nobody even runs against them. So I would like to see a lot of turnover in Congress, where these people go for a short time as a sacrifice to their lives. That's what I like to see, is politicians sacrificing their personal gain to serve in public office instead of personal gain that results from serving in public office. That's too much of that going on. But let's get some of these out-of-touch people out of government and replace them with people who have a clue as to what it's like to live with the rules and regulations they pass. So I mentioned before I will do a video clip at some point on some other healthcare systems, and I'll sprinkle that throughout the next few months so that you can get a feel for what these things are all about. Sometimes things sound fabulous. They just, in their execution, not so fabulous after all when you get to know a little bit more about them. All right, that's all for today and all for the week, actually. So pass this on to anybody who you think might enjoy watching it, and I'll be back to you next Tuesday with more news.